So at places that are not successful, the employees have no expectations. To them, it is a mere paycheck. What I've been stunned by at both of my, I've worked at two stellar places. Shadyside Hospital has produced the chairman of University of Pittsburgh Medical Center, the CIO, the CNO, 4 presidents of their hospitals. It really was the place. It was the cash cow. Lancaster General, you can look it up, U.S. News and World Report. Hicksville, USA, where the Amish are? Okay. We took that hospital from a nice community hospital with cement walls to it looks like the Ritz-Carlton, lowest cost in the country, most profitable hospital. Those people had organizational commitment. Okay. Erie County Medical Center in Grady, there was very little organizational commitment. They did not identify with the organization, and that's why I started with that little joke. You guys identify with Georgia Tech, and that means something to you. Places that are not successful, they don't have those expectations. They don't ask questions. They'll do exactly what you want. If you're in reimbursement and every month you see a check for $1 million coming in from the state, that you do something with it, and you've been doing that every year for 5 years for $1 million, and it suddenly jumped up to $4 million, you do something. You tell somebody, right? Not at Grady 2 years ago. They just kept passing it through. And it had a very negative implication for us because no one asked any questions. Gee, this is really unusual. This normal check is 4 times as high. And I could see the first month, well, maybe it's a mistake. But the second month and the third month, and it ended up costing us $5 million. There's no performance because they're not measuring anything, and they do that purposefully, and they become expert at dodging responsibility, dodging questions, dodging commitments. The dog ate my homework, the bus was late. And we put in a fingerprint time card system. Okay? And when I got to Grady, you could be late 16 times and nothing would happen to you. And I cut it to now you can be late 7 times and you would think I've killed everybody's child. Oh, Mr. Young. And I say, I've been coming to work for 30 years. I haven't been late one time in 30 years, and I live in Atlanta too. And, well, you don't punch in. I say, yes, I do. Okay? So there's no performance. Moreover, the company has no incentives. There's no pay for performance. There's no promotion of those people who do well. You get promoted because you know somebody, or worse yet, you've been there longer. Okay? And smart people figure that out. And if they know they're doing a good job and they know they're not going to get promoted, they're going to go work at another company, and over 20 years your company is in Loserville. And they have no product that they believe in. Less than 1% of our employees were getting their health care at Grady. Less than 1%. Did you need to know anything else about that? Okay. So last year we switched the health plan. Dear employee, if you come to Grady, your x-rays are free. If you go to somewhere else, your x-rays cost you 50% out of your own pocket. And they screamed, Grady sucks. It really doesn't, but that's what they thought. There are big waits. And I said, but wait a minute, that's your fault. That's your problem. You work there. You fixed the product. And now it's a year later, and they're actually very happy, very satisfied customers. We're paying ourselves left pocket, right pocket, instead of sending money to our competitor hospitals. And my health care costs actually went down 10% last year. Georgia Tech's are gone up next year 10%. Mine's gone up 0. Okay? Now they believe in the product. Okay? So these are what happens in less than successful organizations. A winning organization has high expectations. How many of you would go into a loser company and take 40% of your pay at risk? Anybody? I did. And I knew I'd get crucified in the newspaper. Oh my God, he got a bonus. And my boss said, gee, I hope we have the same problem next year. And the reporter said, well, what problem is that? A $65 million EBITDA improvement. I'm glad to pay $350,000 for a $65 million EBITDA improvement. We now have performance measurement at every level. Last year, we did the old Grady way. We just gave everybody a cost of living increase. This most recent year, in April, there are certain things that you have to do to be a nurse, certain mandatory educations. If you didn't do that, you got a pay increase of 0. What do you think happened to the mandatory classes after that happened? They immediately filled up. All the mandatory stuff is now filled up. In Lancaster, we actually started our own college because we had 10,000 employees. We had a nursing school, so it was very easy. And we put together a curriculum. And in order to move up through the management ranks, you had to take the 26 classes and pass them, and no one went. So we finally said, I'm sorry, I'd like to promote you, but you didn't take the classes, so you're ineligible until you take the classes. The classes filled up. We taught our middle managers exactly what we wanted them to do, and they worked well. And I turned over 80% of the management team at Grady. I told a new guy who's running my nursing home, I said, if I had to do it over again, I wouldn't have given them a year's worth of evaluation. I would have given them a quarter. So you've been here a quarter. I want to know who you're keeping on Friday and who you're getting rid of. And I don't say that in any negative way, because at the end of the day, without Grady, the whole healthcare system in Georgia becomes a mess. Without this nursing home, there is no free nursing home in Georgia. It's a mess. So I have to look at my obligation to 250 residents who are sick and need help versus 10 managers who've wasted tremendous resources. And what's the responsibility there? And the answer is the responsibility is to do the right thing. So what is leadership? It's really very, very easy. It's getting the right people. Okay? The first month I was at Grady, 75% of the employees who we had interviewed and selected, once we did their drug test and their background checks, 75% of them flunked it. This is the people that we picked. So we've turned over our entire human resources department based upon the last slide, hiring people who know how to find motivated people, people who will take responsibility, people who will set expectations. And we don't have that problem anymore because now the word is out in the street. Grady's looking for strong players. Plan. You need to have a plan that you can understand and has to fit on the back of a business card. And it has to be comprehensible from the chief of trauma surgery to the housekeeper. It has to be very simple. It has to be believable. If your plan in 2010 or in 2009 was to grow real estate volumes by 25%, what are your people going to do? They're going to laugh at you. They're going to laugh behind your back. It's going to ruin your credibility, and they're not going to follow the plan. So the plan has to be real. That doesn't mean it can't be a tremendous stretch goal. When I told people at a public, unionized, governmental hospital in New York that we were going to be the leading hospital in 3 years, they looked at me like I'm nuts. And we're putting in a new computer system, and one of the consultants is from Buffalo. And I said, oh, you're from Buffalo? She says, yeah, my parents are still up there. And I said, well, do they go to the hospital? And she said, oh, yeah, we just got out of ECMC. It was great. They wouldn't have said that 5 years ago. Policies, I hate them. I've been CEO since 1988, and I have never written a policy. When I walked into Grady, we had this many pages of policies. Policies stifle people, okay? Did you ever read about the 5-year-old kid who was suspended from school because he had a 3-inch or a 1-inch pocket knife because he was gone to Boy Scouts because they have the zero tolerance policy? Policies are for people who can't make decisions, who can't be consistent in their decisions. They will kill you. So when you go work at these big places and they give you policies, you can say that crazy man from Georgia told us policies aren't necessarily good. Maybe you better wait a couple weeks before you say that, but policies are overrated.